Hello, everyone. Welcome to the another episode of the LIT podcast. In today's episode, we'll talk about this common type of cancer, which is found in both men and women, but it's more frequently found in women. Basically, our body is made up of tiny cells, and when these cells in the breast grow and multiply in an uncontrolled way, it forms a lump or tumor. It is said the earlier the breast cancer found, the better are the chances of the treatment and recovery. So, in today's podcast, we have a renowned breast surgeon, Dr. Anupama Mane, who has 23 years of experience as a breast surgeon. She is associated with Ruby Hall Clinic Pune and is known to be a principal investigator in several national and international trials in breast cancer. She will help us to understand why breast cancer is increasing among young women, what are the symptoms, how can it be treated, does pregnancy or breastfeeding affect the risk of breast cancer, and what lifestyle changes do we need to make to avoid the risk of cancer in our beautiful bodies. So without wasting much time, let's get started. Hello, doctor. We'll start with a very basic question. How are you?
Hi, Anshul. Thank you for the kind introduction. I'm good, thank you.
Okay. So, doctor, I'm quite eager today. Growing up, I remember how my near ones were affected when one of my aunt was diagnosed with breast cancer. It was tough to see her go through all this pain and suffering. But today I have this chance to go deeper into understanding the cause and treatment of this deadly disease. So, doctor, the question is, why are we seeing more cases of breast cancer in younger women? And more importantly, why is it discovered when the cancer has already progressed to a later stage?
So basically, in India, India is a very young population, and as compared to the Western countries, in India, we are seeing breast cancer more commonly in the younger women. In Western countries, it's the older women who are affected by breast cancer more. Now, there could be several reasons for the increase in the younger women. One, of course, is also increased awareness because the younger women, especially in the urban areas, they are little more aware. They come for checkups, and obviously some of them then do get diagnosed. We have better reporting systems now. We have registries, cancer registries now. So we are recording the data more than earlier. So obviously we are catching cancers more than earlier. That could be one apparent factor. But more important than that is the lifestyle factors and the environmental factors, the genetic factors, the hormonal factors that affect the younger women more, as a result causing breast cancers in younger women.
Okay. So, is there a difference between, the process of detecting and treating breast cancer between younger and older women?
So, the symptoms remain the same in younger and older women. That means any breast lump, any lump in the armpit, any bloody nipple discharge, change in size or shape of the breast. So, the symptoms are the same in younger and older women. But in younger women, the diagnosis is more difficult because they have a more glandular breast. They have thicker glands. The tissue is thicker and denser. So tests like mammography and sonography many a times are not very accurate in younger women. And secondly, because the diagnosis is more difficult, the treatment also becomes more difficult in younger women. They have hormonal factors affecting their breast cancer. In older women, the treatment is much simpler.
And it is all because that younger women have this, what you said, thick, I'm sorry, I did not understand that, thick glands. That's why it is tough.
Yes. So what happens, breasts undergo a lot of changes during the life history of a woman. So when the women are young, the breasts are thicker. They have more milk glands, milk forming glands. They have less of fatty tissue. But as the women approaches menopause, the fatty tissue increases and the glands reduce in size, because obviously the milk producing, and post menopause in older women, the fat increases still more and the glands reduce still more. So as a result, the breast density, which is very dense initially, becomes lighter and lighter as the woman ages. Hence, breast cancer detection is easier in older women, not so easy in young women. Especially, younger women also, some of them have pregnancy and breastfeeding related changes. So they can cause the diagnosis of breast cancer to be more difficult, because usually in this stage, many of the women feel it's just a milk lump. Many of the, their family doctors also feel that, oh, this lady is breastfeeding, so it's just a lump of the milk glands. It's nothing else. It can't be a cancer. Things like this. So the diagnosis becomes late in younger women.
So now when we talk about genes, you said that genes does play a role in, breast cancer, right? Now, can anything be done to change it? I mean, can we reverse the genes, or, if I know in my genes I have this, breast cancer issue, so how can I protect myself?
So, genetic breast cancers are only present in approximately 5 to 10% of all the breast cancer patients.
Mhm.
So, you can see it's not a very, very important factor. 90% of the breast cancers that occur are sporadic. That means random, without
Okay.
any definite known factor. But in the
Mhm.
ladies who do have genetic as a main factor causing the breast cancer, it is usually because of a mutation in their genes, which they inherit from their family members, mostly mothers, grandmothers, or even from the paternal side. This gene
Mhm.
can be transmitted to the children.
Okay.
So there is nothing you can do to change your genetic blueprint of the body. If you
Mhm.
have the mutation, you have the mutation. You are at a high risk of developing breast cancer. But there are certain steps that you can take to detect it early and even to prevent it. That's a
Okay.
very huge topic, but prevention can be done medically with drugs that can be given with tablets that you can take. Prevention is also surgical. That means if suppose the breast tissue is removed, then obviously you can't get the breast cancer.
Mhm.
Things like this. So this is a very detailed topic for discussion, how to prevent it, but you cannot change your genes. That is something you're
Okay.
born with.
So does these birth control pills or hormone replacement therapy, it impacts the risk of developing breast cancer in women?
Yes, so there have been several studies conducted over lakhs of women, especially in the West, which have come to this conclusion that oral contraceptive pills, especially the combination pills of estrogen and progesterone,
Mm-hmm.
if taken for a very long period of time, more than 5 to 10 years, or even hormone replacement therapy, which are the pills which are taken after menopause to reduce the menopausal symptoms, if taken over a very long time, can increase the risk of breast cancer. But there are
Okay.
caveats to that. If a woman really needs to take these hormonal pills, she can consult her oncologist and gynecologist, and they can tweak the pills. They can give her the mini pills. They can give her pills which have very less doses of the hormones, which do
Mm-hmm.
not have the hormone progesterone. And she
Okay.
can take it for a short period of time, like maybe 6 months, maybe 1 year, very short period of time, not 5 years or more as in the earlier studies. Hence, the
Okay.
breast cancer risk will remain very low for her. But for these women to take these pills, they have to be under constant medical supervision. They cannot just go to the chemist and take these pills themselves. They have to be
Okay.
aware about the increased risk of breast cancer.
So, I remember when I was pregnant, I have two babies. So, I was given injections, progesterone injections, right, on my bumps, and it was given continuously for 4 months. Okay, so will it impact my health?
No, no, that is a very short period of time. As I said,
Mhm.
taking extraneous hormones for a short period of time, 6 months to 1 year, it's okay. It does
Okay.
not really have any long term impact. But you're having these hormones for years together
Mhm.
without interruption with high doses of progesterone, then it increases the risk.
Okay. And I also remember, while I gave birth to my babies, I read an article where, I was reading the benefits of breastfeeding. So one of the benefits it mentioned was that, breastfeeding reduces the risk of breast cancer who breastfeed their babies for a longer period of time. So is it true?
It is. It is. So how it does that is while the woman is breastfeeding, the hormones are at a lower level. The
Mm-hmm.
periods are stopped. So as a result, what happens is some of the breast cancers are related to the hormones. Since
Okay.
the hormones are at a lower level, the periods are not coming yet. Hence, the risk of breast cancer remains low. And this phenomenon you see more often in the rural women. So you
Mm-hmm.
must be aware rural women have multiple children, three, four
Correct.
children. They breastfeed for 2, 3 years each child. And obviously, that is the reason for them to have a lower risk of breast cancer. In case of urban women, we have like hardly one child, maybe two,
Right.
and don't breastfeed because of our jobs and careers. So that increases the risk of breast cancer.
Now, when we talk about detection, doctor, what is the most effective way to detect breast cancer?
Mammography is the gold standard test to detect breast cancer. cancers. It has been tried in screening methods and in diagnostics also. And in screening, if you do regular mammography, especially in the older women above the age of 40 years, it can reduce the risk, the mortality is the death rate. It can reduce the
Okay.
death rate by breast cancer by about 30%.
Okay.
Okay, so that is a very major, you can say, improvement. So mammography is a very good screening method. Screening means woman who doesn't have any symptoms goes for a checkup to pick up any breast
Mhm.
cancers. So then we
Okay.
do a mammography for her. Diagnostic means a woman who has a symptom, who has a breast lump, goes to the doctor and we check. In
Okay.
this case, we might do a mammography, we might do a sonography also.
So, what is the correct age for a woman to get the screening done? And how
So
often should they go for these screenings?
in India, we don't have any breast cancer screening programs. It's very important to know that. In
Mm-hmm.
Western countries, they have very regularized government run screening programs. So, the patients, the people are called at regular intervals. They are sent invites to their home to come and get themselves screened for breast cancer to do a mammography. In India, because we don't really have, so what we advise is above the age of 40 years for average risk women, a mammography to be done once every 1 to 2 years. After the age of 50, 40 to 50 is 1 to 2 years mammography. After the age of 50, she can continue it annually till the age of 70. It can even be extended up to 75 if the lady has very good health. And this, what I'm talking about, is for an average risk woman. What do I mean by this? That means this lady doesn't have any family history of breast cancers or ovarian cancers or other specific malignancies which could be related to her genetic mutations or
Mm-hmm.
anything. So an average risk who has no other family history and no other risk, who has children, who has breastfed them and all that, the general population. But in
Okay.
high risk patients, high risk means a lady who has a very strong positive family history needs to start her screening much earlier. She doesn't need to wait till the age of 40 years. She can start her screening at least 5 to 10 years before the family member who had breast cancer,
Okay.
before the age of the family member who had breast
Okay.
cancer. So, in
Okay.
other words, suppose her Mossy had breast cancer, maternal aunt had breast cancer at the age of, say, 50, then she needs to start at 40.
Okay.
That way, much younger.
Doctor, I often wonder one thing. It's not about breast cancer, it's like general cancer. Like, why do healthy people get cancer? Because, in my family, there were 3 to 4 people, okay, who were quite healthy in their lifestyle, who never ate junk, who never had the consumptions of alcohol or drugs, and still they suffered with throat cancers or breast cancer. What is making, why are they getting diagnosed with cancer?
So, this is a very difficult question to answer. Even the scientists, after decades of research, haven't come across one specific factor that can account for this. There are lifestyle factors, as you mentioned, sedentary lifestyle, lack of exercise, obesity, alcohol, or chewing tobacco. All these are known factors. But it happens in many normal people who do not have any of these factors also to develop. It's known to
Right.
develop cancerous tissues in them also. Exact reason is not known. I'm very sorry to say. We can't really pinpoint what is the case in each particular patient. The factors we know, I feel, the modifiable factors, we can only modify them to prevent the cancers.
Okay, so what lifestyle changes would you suggest to our younger women and also the older women so that they can avoid the risk of getting breast cancer?
So, lifestyle changes include dietary changes, first of all. So, a healthy diet.
Mhm.
And I'm not talking about only breast cancer prevention, but a healthy diet will also prevent against many other diseases like diabetes, hypertension, or other chronic diseases as well. So, a healthy diet, including a high fiber diet, plenty of green leafy vegetables, fruits, salads, less of carbs, and less alcohol, obviously, no smoking, and a Mediterranean kind of diet is helpful. Even our Indian diet, actually, for that matter, is quite good. If you can just omit all those,
Mhm.
aloo parathas and vada paos and all that. So, no junk food. A healthy diet, basically, light diet, multiple frequent meals of good healthy stuff.
Okay.
And apart from the diet, lifestyle includes exercise. So, exercising every day for say about half an hour, moderate intensity. It could be a combination of aerobics, it could be yoga, it could be strength training, and you could alternate these every day, but at least half an hour of exercise every day. Even some women find it difficult to do heavy intensity exercise, just normal walking is also good enough, fast walking.
Okay.
So this is something that really needs to be, this message needs to get across to the women at large.
So, as compared to the older days, are there any recent breakthroughs in treating breast cancer?
So the treatment of breast cancer has changed dramatically over the last 20 years. Earlier, you might have been aware a lady with breast cancer would have to undergo her breast removal,
Right.
whole breast removal, and heavy toxic chemotherapy would be given to her, and radiation therapy, machine ki sikai jisko bolte hain, would be given, and all that. Nowadays, it has changed so much that a woman need not lose her whole breast.
Okay.
We can just remove the breast lump with normal margins and treat the breast cancer. The axillary lymph nodes, the armpit lymph nodes, which used to be removed earlier, would lead to a lot of arm edema. Now that is not required. We have methods to prevent that, surgical innovations. Then in the chemotherapy field also, a lot of, the toxic chemotherapy can be avoided. Milder, better drugs, targeted therapies, hormone-related therapies can be given, which don't have too much of side effects. And the radiation techniques have changed so much that all the radiation-induced side effects can be avoided. So I really feel if a cancer is detected early, then the treatment is also minimal. And the cure rates are also very high. And that is why we stress so much on screening for cancers, finding them early.
It was such an eye-opening conversation, doctor. Thank you for being here with me and sharing your expertise and knowledge to help my audience.
Thank you so much, Anshul. And I hope this message reaches a lot of women and they can benefit from it.
Yes. Okay. Thank you.